today on the
Um,
SPRINT program, okay?
okay, okay.
So I'm going to give everybody another 3-4 minutes before we
Mhm.
start our
That's
training
what
today.
this-
So I will show everybody our platform and how to sign up and log in and be able to submit business with the Smurf program. So we'll give it another 3-4 minutes and then we will start our meeting. Or should I say training? Anybody have any questions or anything the next 3 minutes before we start?
Yeah,
If
hi
you
Bobby.
do, unmute yourself.
Hi Bobby Don Moore, DMV. How you doing?
Good. How are you, sir?
I'm fine, sir. Good to see you again. I do have a question. I want to send some information to my employer, which
Hmm.
has 11 campuses around the U.S., over 200 employees.
Okay.
How do I send? What information would I send to the corporate, the manager or the decision maker?
Okay. Let me ask you this: Are you a consultant, or
I
have
Yeah,
you logged into the EBS Health website, the platform?
EBS platform.
Yeah. Have you registered for that?
I don't know what that is.
All right. I'm about to show you. Okay.
Yes, sir.
I'm going to show everybody today
Okay.
how to get on that. Okay.
Okay. Good.
So if you are a consultant, then you have authorization to be able to get on that.
And I am. I've been in here a year and a few months.
Okay. Yeah, so it took us some time to put all of this together and especially have the AI so that we can make things easy for all of you. So right now we're ready to relaunch and do everything we need to do to really submit business. There's and I and I'm your lifeline. I am the person that's going to do the quality control. I'm the person that's going to train. I'm going to be the one that will help with all of this, step by step. And
Great.
I'll be training on this. I'll even have scripts later on, and a process. I will be working with our marketing team with Katrina to put all of this together. So maybe in a week or so, we'll have it all up with the new website. We're working to finalize all of that right now.
Great. So will there be someone, if a corporate entity wanted to talk to someone, will there be someone a number we can put them in or a calendar we can put them in?
Yeah. Yes. You can send them to me, and I can definitely talk to them. If I'm busy, then it'll be Corey or Hugh. Yeah, we have somebody. But beforehand, we're gonna want you to find out as much information as possible.
Yes,
Um,
sir.
so, all right. We have
Right.
a number of people on already. I think I will start our meeting today. Welcome everybody to the call today, and today we're going to be focusing on the EBS platform. We're ready to launch and be able to submit, a lot of business with the Smurf program. I'm going to give you guys a little crash course on the Smurf program for those that don't know. Hold on. All right, hold on 1 second. Let me share my screen. Uh, okay, everybody can see my screen, EBS Health? Yes?
Yes.
Okay. All right, so once you are a consultant, you will be able to register with this account here. So once you register, then you go to where it says login. Okay. And once you log in, you're gonna put in your email. You'll be a business owner. So I'm gonna put in my email right now. So whenever you put in your email, it's gonna send a link to your email for you to log in. So, all right. So they just sent me an email. Now I can log in. Oh, this one was here earlier. All right, let me get a new one. Oh, okay. Yeah. All right, this one was the latest one because I tried logging in. So you will have a dashboard like this, okay? And in this dashboard, this is where you can submit business. So if you have a company, you want to be able to put in their name, address, email, what type of industry, whether it's like restaurant or whatever it is, number of workers. And remember, with the SMART program, you need at least three W-2 employees. They have to be full-time, company address, and then you can submit. Now, if you wanted, like if the business wanted to have a meeting with our consultant, you can after that you can actually book the time, okay? And then we will get onto a Zoom call and pretty much do the presentation and talk to them about the SMERF program. So everything is on here. So but you need to register and then you need to sign the contract and then you will get this dashboard. Now on this dashboard, let's just say I could see my sub-affiliates. So all of you guys that sign up, all of you guys are going to be under me. Okay. Every single one of you guys will be under me. And when you go into your own dashboard, and let's say if you build a team, you can also see your team in here too. How who's in your team. You can see everything that's going on. But the most important thing in this whole dashboard is where the marketing materials. I'm going to go through all of this so that you can see. Uh, so you can see what it's all about. Okay. So let's just say the summary benefits. This is just basically a couple pages that tells you a little bit about the Smurf program, how how much a business will save. Let's just say if a business has 100 employees, and how much they're going to save, or further down here, what $150 a month will be able to help them with. Let's just say if they had an allotment of $150 a month, they will be able to get short-term disability, accident insurance, hospital policy. They would also be able to get critical illness and cancer. Now, $150 can pay for all of this. See, this is why when you go into the business, you can help them because even if they have insurance already, look, if they end up in the hospital, they get $2,000 for the first 24 hours stay. And then if they stay there another day, it's another 500. Now, that's for the accident policy. Now, there could be an accident on or off the job, it doesn't matter. Or if they stay in the hospital, now they have another $750. The average deductible for a health plan is $3,000. So if they had a health insurance plan and they had this, all of a sudden that took care of the deductible. So this definitely helped, but if they don't have an insurance plan, guess what? This will also help just in case they get in a situation where they need some kind of health coverage. And then, it also gives you critical cancer, life insurance. It's a guarantee issue. And remember, this doesn't cost the business any money, nor the employees. Okay. So the next one is compliance. I'm going to go through all this really quickly, but I want all of you, once you get into this, go into the marketing and read all of this stuff. You can utilize all this stuff to send to whoever you need to if they have questions. So basically, this marketing piece just tells you that this explain this is a cafeteria section 125 cafeteria plan, which is part of the IRS tax code, and the smurf is called a self-insured medical reimbursement plan. And this is all post-tax reimbursement and pre-tax deduction, meaning that they take the deductions out of your taxes. um, and then it goes into how it's complying with the IRS regulations. It's discrimination testing. So this is all compliance. So when a company sees all this, they can really understand what this plan is. All right, next. Now this one is this one. It's not okay. Awareness marketing. Let's see what this is. Okay, so this is another flyer just to say how this works for you. And you can utilize this if you want to send it out. This is an example right here. And we use this a lot because this shows you when somebody gets the gross pay without the wellness program and then with the wellness program. So as you can see, with the wellness program, they're still making the same. It cost them nothing, but then their taxable income went down because we took out for the wellness program, utilizing their taxes. All right. And if you can look down here, you're going to see that their net pay, why is it a little bit more? Because even after we use the money, and I'll show it on another example, use the money for the wellness program, you still have an overage. So this person actually made some money, after it's said and done. So, all right, let me go through another. See, there's a lot of marketing pieces here. The next one will show you. Well, I gotta enlarge this. Show you the process. You get the prospect, you make the appointment, you fill in the CRM like I showed you, and then you collect the paperwork, and then we do a quote, and then afterwards the owner decides that they want it, then they sign, and then we enroll the people in step 5, and then step 6 will be enrolling them. Well, step 5 is basically meeting with the employees to let them know what they have available for them, and then the enrollment part will be step 6, and then once everything's submitted with payroll and step 8, you get paid. So you can go through all of this. This is step by step how the process works. All right, the next one is very similar. Same thing, just more detail. The person that put this together, he's very detailed with all this stuff. So you can go through all of this and kind of get kind of like this is the roadmap of exactly what's going on and what steps you need to follow in order to enroll somebody. All right, so I need all of you to really, read all these steps and be able to follow that. This is a template. This is very important whenever you guys, let me open it. All right, hold on. Let me open this. All right. You can see this template here. This is something you need to collect from all of your businesses that you have. We need to know the name of the employers, I mean the employees, date of birth, gender, work state, zip code, fill in as much as you can because that's how we can come up with the allotment, the proposal. So you need to fill all of this out.
We still see the marketing material.
Oh, I didn't share this one. I'm sorry. All right, hold on. Okay, I'm sorry. All right, can you see it now?
Yes,
Can
sir.
everybody see it?
Yes, sir.
Okay. So this is a template, and this is the template for you to enroll your the businesses that you run into. Okay. So whether they fill it out for you, you fill it out for them, you need to have all this information for us to come up with a proposal. From their social security number, their email. Why their email? Because once we enroll them, we send them a survey. They will take a look at, what's important for them: dental insurance, health insurance, life insurance, whatever it is. They would answer those questions, and then the algorithm will come up with the plans for them to choose. And once they choose the plan, then we enroll them. But we need all this information. If they have dependents, put it all in there because this program not only cover for them, it covers for the dependents also. Okay, so you need to fill all this out for us to be able to, get them to really to be able to put the proposal together. So you need all of this information, and so you can utilize that. All right, so let me go back to the other screen. All right, let me see.
Should we interject a question here or wait to the end?
You can ask a question. Go ahead.
Well, when you were saying we need to fill out that information, I'm feeling that we might get some pushback regarding the social security numbers because people are very skeptical about giving out that particular information a lot of times.
Well, the fact of the matter is, if they don't give that all the information, how do we look? We're setting this up for them. By the time that they agree to this, they will give us all that information because that they can provide it, or we can go into the ADP or Paychecks and retrieve the information. But if they're like, oh, we don't want you to know our social security number, then how can I set up, your benefits if
But
I don't have the information? Because regardless, I'm going to get your W-4 because you're going to need the W-4 and 2 months payroll. So all that has their social security number on it anyways.
okay, so by the time they get to this stage, they should be comfortable
Yeah,
providing
they
the.
should be. You're not
All
asking
right,
them offhand. Yeah, but if they agree, they say, yeah, I think this is something that we are able to do, then, we'll get that information.
got it. Okay,
If there's a pushback, then maybe they're not that interested. So you see what I'm saying?
yeah, we're just trying to see how far along in the process we need to be before asking for that type of information. So you're
Okay.
saying that we should be far along enough to be
Yeah.
comfortable to
Yep.
retrieve it. All right, thank you.
All right. So let's get back. You see the marketing, right? Okay. So we got the template already. Um, the wellness urgent care. Okay. This here just basically lets you know that with the wellness program, you can get, the virtual urgent care. You can see a doctor virtually for all of these common conditions. You can also the we have the wellness counseling, psychologists, a psychiatrist. All of this is available once they sign up for the wellness program. Okay, so this is like a bonus. And they also have the behavioral therapy, health, all of that. So these are different flyers that you all can use because it's available once they sign up. Even dermatologists. So utilize all of this. Now, this last presentation, this last thing on here is the actual presentation that we actually use to let people know about the SMRF program. So as you can see, they have to have W-2 employees, minimum 3 employees, and they have to make at least 27,000 a year. Okay. And they must have health insurance in place or not, it doesn't matter. And here it just basically lets you know that they could lower their taxes, average $630 annually per employee. Their workers' comp is going to be decreased. They're going to save on that because you're going to have accidental insurance, critical illness, and all of that. And of course, they're getting insurance for their employees or a benefit that can benefit them at no cost to them or the employees. This is just shows them how much they'll save if they had 100 or 500 or 1,000 employees. And here it shows you that, because a lot of people say this is too good to be true. Let them know this is part of the IRS tax codes. Tax code 125, 106, 213. And here's the explanation. 125 allows the pre-tax deductions on certain health-related benefits. 106, the amount of the deduction or premium of the health plan being offered. In this case, wellness is excluded from the gross income, therefore allowing you to lower your taxable income and create savings. And then the tax code 213 provides us with categories that are eligible for reimbursements, and the criteria for total compliance. A wellness plan falls under preventive care, which is within the categories mentioned. These 3 tax codes, it's basically the SMRF program. And when you show if they want to show to their accountant or whatever, this slide is very important. All right. So I want you to show you this next slide here. Let me enlarge it. So you can see this is a sample of what I showed earlier, where if somebody, is making 41, 48, 83 without the wellness and with the wellness program, and we took out for the wellness program here, reimbursed it here. Their taxes is lower because of the wellness program. Now, earlier I showed that this is their net pay without. This is the net pay with. Why did we have the $17.60 available? If you look further over to the right, the wellness program, they had $116.10 to spend. So they spent $42 on the life insurance. They had $34 on the I don't know which insurance is that, but they also had the accidental insurance and the critical, no critical illness. But this person here had an overage of 1760. So the rule is that we have to spend as much as we can, but there will be overage. And what that overage will do is reflect in their paycheck. So for this person, they got into the wellness program and they actually made some money. We're paying them to get it. I mean, but they have all this is an example of how it will look in their paycheck after they have their wellness program. This slide by itself, folks, is what sells the program. So, you can show this one all day long. And of course, this explains further of pairing the SMRF program with, the accidental health insurance and all of that, how the allotment stems from the tax savings created, and, they could use towards critical illness, hospital, dental, vision, life insurance, all of that. They can use and at no net cost. And again, this slide just shows you, you know, where you can get vision for $33, dental for 33, life insurance for 65. So just an example of an allotment of how much they can get for each one of this type of insurance. But, when you have a customer, it doesn't mean that they are going to, you know, get every single thing. Some people might say, I need dental, and I need, the accidental or the life insurance, or, whatever they need, we will personalize that for them, because once they receive our email about enrollment, they will take a survey, and the survey will ask them questions that would basically tell the algorithm what they're interested in, and then a couple plans will pop up, and they just choose between those. And then this basically is also a roadmap. Here, qualification process. The client submits W-2 and W-4 form of the last 2 months' payroll. Our underwriting team qualifies and reviews the documents. When we say qualify, this is what I mean. Now, because this rule is part of the also aligns not with just the IRS, but the Affordable Care Act. For the employees that have Obamacare, they can't have this. They have to choose one or the other. Okay. So you may go into a business with 10 employees, and then all of a sudden, maybe three of them has Obamacare. Now they won't qualify for this unless they drop their Obamacare. But sometimes the Obamacare will be much better than what we offer here. All right. So just keep that in mind when we say we have to qualify. And we review the documents because we want to make sure they're full-timers. Because if part-timers under 30 hours will not be able to qualify. So keep that in mind. And then our accounting department will run the calculations to send the proposal to the owner. And then our insurance professionals review the best plans for the implementation. And then after the owner signs the proposal, then well, actually, we will be giving instructions how to set up the program with the payroll, and then the proposal we give to the employer, and then the employer will see, a sample of like that paycheck that I showed you, and then once he signs, then we will send an email to all the employees, and then we may even do a Zoom call, or explaining the program and set up when they should enroll. And then once all the employees signs a paper to say whether I participate or do not participate, because maybe they chose their Obamacare instead of this, then we will, decide, then we would know how many of those employees will be enrolling. So once all that's done, then we run the next payroll will reflect that, and the owner will see his FICA tax savings, and then once the wellness fee is paid to the company, to EBS Health, they will disperse the pay to us, and then we pay you guys. So if everything works out and you guys collect the paperwork and the owner, everything is fast, we maybe even be able to get this done in 3 to 4 weeks. And then you may get paid 2 weeks later. But if you do it fast, where, hey, they're ready, they got everything, we might get everything done within 2 weeks, and then you get paid within 30 days. It all depends, because sometimes scheduling and enrolling the employees, all of that, it's the the timing all depends on how fast the business goes and how fast we get the paperwork. But this presentation here, you can send it to whoever you need to send to. But everything we have in here. Now, once we have the or the owner has the account, they will be able to upload paperwork. If you look in here, license and information, 1099, you can upload and then you enter, okay, W-4, or payroll, whatever it is. And then you can upload the paperwork here once, or, you can say, this is the census, whatever this. Once you upload it here, our people will take a look at it. We will process everything and be able to move it to the next step. If you have any questions, you can go here where you can chat with our admin. Now, if you don't have business sending in, don't send anything here. Go through me first, because they want to make sure that you have the business sending in and the question pertains to the business that you sent in. Okay, I don't want anybody coming here asking random questions every single day, because they're not gonna have time to answer every random question. But it has to pertain to a business that you sent in already. Okay, so this platform is very user friendly, and you know, you just follow the steps. So the most important thing, once you guys get your account and your landing page here, then you can go into marketing materials and follow all of this. Now, let me go to home. Now, if you want for people to even upload or go into the account, you can copy and paste this and it'll take it to the landing page. All right. So to your landing page. Yeah, you can do that too. Okay, I guess I will be opening to questions now. If anybody have any questions on this, because today that's what our focus will be, is training you all on this. So I'm going to open the floor for questions.
This is Ray. I didn't catch the first part on how to get to the landing page, how to access or log in.
Okay, I'm gonna do it real quick again. Let me go back out here. I'm gonna log out.
And is this link to log in on our back office? I mean, on our product page?
Well, you got to go on this EBS.health. Okay.
Okay.
Once you go in, you're gonna see. Oh wait, did I log out? Let me log out first. Sorry, I didn't log out. Okay. Now you go on to EBS.health. It's gonna show you this. Now you're gonna log in. Now, every time you log in, remember you're business owner, not employee. The employee will get their own landing page too once they enroll, so they can see their account and everything. Now I'm gonna put in the email that I registered, and I'm gonna log in. Now, every time you do it, they're gonna send a link to your email. So I'm gonna go into my email.
Yeah, unfortunately, this is really small. I can't see it, but the link is ebs.health.
Yes.
But there's something after that.
EBS.health. That's it.
That's it.
That's it. So you would go into your email and then follow the link and log in, and here you are. That's as easy as that. Okay. Anybody have any other questions?
So you create your own username and password on this page, or use our login from Sequoia.
Yes, you just go on EBS Health, EBS.health to log in.
Yeah, I'm saying the username and password to log in. Do we create one for this page? We create an account?
No. Okay, once you have an account, you gotta sign a contract. Okay, you won't. They will send you a link to sign the contract. Once you sign, then you get your own platform here. Okay. Margaret, did you have a question?
Yes, I do.
Yes.
I have a three question. Number
Okay.
one, this platform, I just want to clarify with you. Number one, is that every Sequoia member need to create the platform by register this site. Like myself, I would register myself as a business owner in order to have access. Number two is an ongoing maintenance fee for using this platform. And the third one, do we have some type of like promotion marketing flyer for CPA or cater for the business owner, only like a one page back to back to show to the business owner or CPA to help them to understand this product.
All right, so we will be uploading a lot of our marketing on our website soon because, like I say, we are launching. We just redid the new website because it used to be Sec Lending, but now we've changed the company name to Sequoia Enterprise Solutions. So we're going to be loading from scripts to talk to business owners to marketing materials that you can use to send out to a certain business owner. We might even come up with an email for you to send out. So all of that's going to be uploaded within the next week or so on the website. So once you go onto your website, you would be able to get all of that. Okay. Now, secondly, once when you are on the EBS Health, no, you don't have to pay anything for the platform. All you pay for is the Sequoia platform. Okay. And we provide all of this for you. EBS Health is a partner of ours that offer let's just say the AI to help us along with this. All right. I hope that answers your question.
How about the third one? We
Third
have
one, what was
like
the
1 to 2 pages
yes, like I
flyer.
say, we will have those. We will upload those things onto the website. You will see within a week or so all those stuff. Okay. So give
Currently there's a promotional, I should say there are material for dedicate for CPA, but it's pretty long, like 8 pages, if I'm not
yes, I'm
mistaken.
I'm currently working with our marketing to let's just say fine tune all of that so that we can send it, put it into the website. So give us a week or so for us to get all that up and running. Okay.
So let me clarify. Are you saying we need to register on EBS.health?
Yes.
Everyone.
Yes.
Okay.
Okay.
Thank you.
All right, Mr. Moore, you have a question, sir?
Yes, sir. It says to put in your email address on that EBS site, and it indicates at the top whether it's business owner or employee. We're putting
Would
in
be
that.
business owner.
Okay, and the email address that we put in is the one we have logged in with Sequoia.
It doesn't matter. Whatever email you want to use, that's going to be the email that you log in. It doesn't have to be a Sequoia email. Okay, it's an email that you're going to tie to that. I mean, I use my personal email to log into it.
Yeah, that's what I'm doing at this time, and it
Yeah.
shows me that the email provided is not associated with any account. It won't let me send it to my email.
Talk to support.
I will.
Talk to support to take care of that.
I
Email
will.
support.
Sure.
Okay, and they'll
Thank you.
handle that. All right, let me go into the chat. I think there's a number of questions here that. All right. Okay, Mr. Winchester, you are asking, what if the company provides their employees what we offer? Do we offer family medical leave? All right, Mr. Winchester, what we offer is a cafeteria plan, which is a supplemental insurance. The most important thing about this is that we're giving the employees benefits that they don't have currently. Let's just say if they had regular health insurance, They might not have this, but this is zero cost. And then the company can save on their taxes. So, but as far as family medical leave, that's something between the employee and the employer. It has nothing to do with us. Um, I hope that answers your question, sir. All right, I got Mr. Johnson. Is the company required to get permission from the employee to provide Social Security number? Of course, that's something that their HR or whatever the case, but I think because they have their taxes and if they need to do something, I don't think they have to provide uh, permission because they are the employer that they're doing benefits and everything. I don't think they need permission, but I don't know the guidelines for each company, so so that's something you got to ask them. Okay, May asks, is this plan cheaper than Obamacare? All right, so cheap or not, remember they're getting these benefits at no cost. So let me explain the difference between Obamacare and this plan. Obamacare is basically your comprehensive insurance. What does that mean? What that means is Obamacare is a program where low income can get a subsidy to pay for their premiums every month. Okay, so Obamacare will have a deductible, they will have a copay, they would have a network, and a supplemental plan is different. A supplemental plan is basically it's like a fixed indemnity plan, meaning okay, like I showed you earlier, if they end in hospital, they get $2,000. I mean, if they have an accident, they get $2,000. If they have surgery, they get another $500. If they're admitted in the hospital, that's another $500 a day. So it's a fixed amount, and it offers life insurance. So if something happened, then they get a guarantee issue whole life. There's no blood work or anything like that. So it's different from your comprehensive insurance. So Obamacare is comprehensive insurance. This is supplemental insurance. So that's the difference. Is it cheaper? Of course, because it doesn't cover as much as Obamacare. Because at the end of the day, if I run into a business that has Obamacare, I mean, a client that has Obamacare and one that has, uh, you know, the supplement, of course, I'm going to keep them in Obamacare because that's comprehensive. That covers everything. You know, but let's just say you get a company that has insurance for their people and it's group health. Guess what? They can have the group health and this because the group health plan might have a $3,000 deductible. They end up a hospital. They have all of this to cover for the deductible. You see? So this complements that. The only thing about is that this program aligns with the Affordable Care Act, which is also known as Obamacare. So you got to choose one or the other. And if you have, let's just say if a person, a single person makes about $45,000 a month, they have to pay full price for Obamacare and they can't afford it. Somebody like that might say, you know what, I may not want Obamacare because I have to pay $400. You know what, I may want this. And I'm young enough, I'm 30 years old or whatever. Then this might look better for them. Okay? So that's you have to be able to determine that or at least explain that to them. This is a supplemental plan. This is not comprehensive insurance. Okay. I have another question here. Yu Ying, the client will load the file from landing page URL. Yes, they can load. Remember, once you register for the client, they can sign on their own page and be able to upload all the paperwork themselves. They may not even need you. Okay? Because when they put in their email and everything, they can go on themselves to upload everything and follow the progress. They can see if all of their employees have signed up or not. They can see all of that. So, they have their own landing page once they register. Okay, I have two. All right, next question. With the G2 also, they have health and wellness. Also, if I sign the contract with EBS, am I allowed to do health wellness or G2 or any other company? The contract doesn't mean that you're captive or anything like that. Remember, you're part of Sequoia, and EBS Health is only a partner of us to provide the enrollment and the AI. Remember, all of you guys are under our umbrella. You don't even need a license to do all of this because you're not the person enrolling them. You're the person sending the business to us. So regardless of what you do on the other side, your license is not needed here. I have a health insurance agency. I have over 85 agents. My license has nothing to do with this business. So please keep that in mind. None of you guys need a license to do any of this. Okay? All right. Yes, the client does need to register with CVS because once you come in, remember this page here. It says register a new client. Once you register them, they can go on their own platform and be able to submit the paperwork themselves because when you enter their email here, okay, they can sign in themselves and they will be able to see the progress of their business. Who signed up? Who doesn't haven't signed up? See, this is the part where we're so different from everybody. It's because we have the AI to be able to do all of this. To help, you know, all of your customers, and even afterwards, after we sign up for them, they have their own platform. Every employee, they can go on there to see their plans. They can go in there to make an appointment, do everything they need to do. Because one thing about health insurance that I've learned, the hardest part, it's easy to sign up people. The hardest part is taking care of them afterwards. So because our AI that we put in, we will be able to help them with all of that. Okay. So that's why that's why we are different from other companies that are trying to do the same thing. All right, Miss Jeffries, can I register through my Sequoia account? Yes, you can. I believe the client can go on there and register because we're putting a link over there. I don't know if you can do it right now because I did talk to Alan about being able to do that because to link everything here onto the Sequoia platform. So if you're not able to do it now, I know you will be because we are working on all of that. Okay. All right. I have another question. Do you have benefit summary that I can share with my employees? Also, does it apply to 1099 contractors earning over 30,000? This program does not work for 1099 employees. It's just strictly for W-2 employees, and they have to be full-time. A business have to have at least three full-time W-2 employees. They have to make at least 27,000. That's the criteria. All right. Which material should I introduce the client? Can you give me the name? Which material? I don't know if I understand that question. Let me see. So I'm putting together kind of like a roadmap for consultants as far as, okay, if you have a prospect, here is what you should say, what you shouldn't say. I'm going to put that together. We're going to have a script for all of you to, because at the end of the day, we want everybody to speak the same language. And we're going to have videos. We're also in the midst of putting videos together to show you guys step by step how to register, what to do. We're going to have, let me see. Let's go into affiliate training here. We're going to have things similar to this. Okay. This here, when you go into affiliate training, you're going to see here, log into the can you guys see the screen? Did I share the screen? The CRM? Everybody see the training? Yes? Okay. So here, we're gonna have things like this where it shows you how to log into the CRM step by step. Okay, just like I showed you. All right. So we're gonna have things like this on our website so that you can step by step so you can see it. So every step of the way, we're gonna have things like this for you guys so that you can make it easy. But if you need to send this to your team or whatever the case, go into affiliate training. But this is just one of the things that we'll have. So yeah, but we'll have more of that that we're gonna upload onto our Sequoia website so that it will make it easier for you guys. We're gonna have our own flyers that we're gonna be coming up with where okay, send this to a business. This is what you should be looking for. I'm gonna be training some of you guys if you guys want to be directors. And why do I want to train directors? Because you can train your team. And if you had somebody that have a business and they don't know what to do, you can help them and then you can make some overrides on that also. So that's going to be part of our compensation plan where if you help somebody outside of your team as a director, you will be compensated. So also, I wanted to mention that a lot of businesses are like, oh, so you're doing this, not going to cost me anything. There will be an administration fee that we will be collecting. Whether it's $99 or a 199, depending on how many employees they have, and you guys will get 50% of that 50% of that administration fee. So we'll put that on. That's something new that the business have to pay for, and that's basically you guys will be collecting that once we do the enrollment. That's something they pay to Sequoia, and you will get 50% of that. I don't know if we've made that announcement yet, but there's a lot of things that we've been working on, and we just at the beginning, you guys are at the beginning, the forefront of this. So please take advantage of it. And our goal is to have 10,000 employees by the end of the year. And you know what? If you're able to help one or two businesses, oh my God, this is gonna blow up because everybody's gonna talk to everybody else, and next thing you know, it'll blow up. You think about it. In America, there's over 2,500 small business. I'm talking about businesses that hire from 2 to 99 employees, hiring 56.4 million employees. I'm talking about small businesses. I don't know if any of those are fired by now, but that's a different story. But anyways, you got 56.4 million employees that you can help out. Okay, that is a very untouched market. Only 3%, not no, only no, not even 1% of the uh, industry, the businesses even is enrolled into this. That's the market that you guys have to work with. We are the first ones, and I would tell you, we have about a year and a half to 2 years to blow this up because we're gonna have people copycat. We're gonna have people that want to do this also. So we're gonna have to work very, very fast. And look, you're coming in helping a business enroll into something where it doesn't cost them anything. It gives the employees benefits that they don't have to pay for, the employer doesn't have to pay for, and the employer saves money in their taxes and their workers' comp. I mean, it's a win-win. And then you make $10 per employee, but if you do over 100 or 200 employees, you can go up to $12, and you do more, you can go up to $14 a month or $16 a month. And if you, as we submit business, we can get a higher contract. Who knows? You might make $20 a month per employee. I mean, that's huge. And all you have to do is submit some paperwork, and then we do the rest. It doesn't get any easier than that. So, I hope you all would take advantage of this. Give us a couple weeks to get everything going and putting all the stuff in onto our website for you guys to utilize. But for now, utilize what you see here what I've trained you on today. And this basically go out there and let people know this is available. All right. So anybody else have any questions? All right. Doesn't seem like anybody have any questions. If not, then I guess we can say good night. All right, wait. I have two people in the chat. Let me see what the message. Uh, all right. Okay, Mr. Winchester, you have a question. Mr. Winchester, you have a question? All right, if you're speaking, then you're muted. Okay, well, will there be a fee, a one-time fee? So the way it works is, when we do the monthly, EBS Health takes a fee out of that already. It's shown in the paycheck. So that's a monthly thing. That's how we get paid on a monthly basis. So we get a little portion of that fee, but as we put out more or put in more business, we might have a increase in that. So yes, that's a monthly thing that it's taken out in the whole process. It's shown in the paycheck that EBS is charging that fee that's taken out because they are the one taking care of all the paperwork and everything else and the enrollment. I hope that answers your question. All right, so anybody else have anything? All right. Well, if you have if nobody have any other questions, then we'll call it a night. And I think eventually in a week or two, I will do training for all of us every Thursday. Maybe in 2 weeks, we'll start doing trainings and basically, like I have a health insurance agency. I have, a lot of agents, and I usually just teach them or share with them how to sell without selling.
Topics for your section with 3 items.
All right. So I'm gonna have a lot of those sessions to help you guys you know, make it easier for you. I'll even show you how to get business like let's say for example this website here where we can get a lot of data. Um, let's just say uh what's a zip code for Houston for Texas? Can somebody tell me a zip code? Anybody? Anybody? Give me any zip code.
76104.
76104. Okay. I don't know where that is.
Fort Worth.
Okay, Fort Worth. Okay. This is a little bonus, okay? This is a website here where during COVID, all these businesses have received the PPP loans. Okay. So you can go on here and you can take a look. All right, let's just say this one, Fort Worth Internal Medicine. They have 10 employees here and they received 106,000 from the government. So we can go on here and we can get the information. We can let them know, maybe even give them a call and say, hi, we're with Sequoia Enterprise Solutions and we're here to help, small business like yourself. And I see here that you did apply for the PPP loan for $106,180, and we want to let you know that there's a program that you may qualify for, that's paid by the government, that will be able to give you your employees benefits at no cost to you and no cost to your employees. Is that something that you may be interested in? Because we're here to help you, businesses like yourself, whatever the case, and you can utilize this to find all the businesses in your area. You know, look, this guy
What's the name of
here,
that? What's the name of that website?
projects.propublica.org. Look at this one. They got 1.2 million. So this is Dalton's best made products. 142 employees. Oh man, maybe I should call this guy. You know, whoever this is. Um, it's a fruit and canning factory. So that's a perfect business because they're all gonna be W2. This is a factory in Fort Worth, Texas, with 142 employees. Oh man, somebody get this information quick. Well, basically, I have a lot of resources for you guys to tap into, but you got to know what you're doing first. I don't want everybody to start coming out there, calling, everybody left and right, and then, saying the wrong things. And everybody's like, who is this Sequoia people? They're telemarketers and they're calling me, telling me that they can give me all this free stuff. So I tell you guys, go through the training first, before you start doing all this stuff. And, I'm just sharing this with you. I've got database where I have the number of all the CEOs of all the companies. All right, but you got to graduate from my class before you get that information. But this is just like a public website. We have many more, but this is a bonus for you guys, but who knows? You go up here, you can see a business that's like a mile from your house. And you might say, hey, I live right in the area. I'm here. I help small businesses like yourself when it comes to benefits or whatever it is, and I see that you did apply for the PPP loans. And, this is something similar to that you don't have to pay anything for. And it's the benefit the government's giving you. And I would tell you what, at this time, when you can come out there and tell them the government is going to help you, oh my God, they'll be jumping for joy, So this is the great time for this, because at the end of the day, people are losing, All right, I got some questions here. If you tell me there's a no fee for the program, but tell me there's a fee when we walk to the companies. Okay, no net cost. There's no net cost to them to get that. But the administrative fee is something different. That's just paperwork. Okay? No net cost for them on a monthly basis to get the benefits. All right, somebody asked me, I forgot which marketing material title you mentioned. We should let the client know this program. Can you say that again? All right. Well, so in the marketing, you can use any of the marketing you want. Let's see. Summer benefits, something like this here. If you go into summer benefits, you can see a flyer. But like I say, we're gonna put more marketing onto our website so you guys can utilize. Even something like this here. Hold on. This one. This is, basically what they get. Okay. This is a good page here that you can use. Also, let me see. Here, this one here, this page right here. This one I like the most because whenever I show the business owner, they can see it, and if they want to show this to your their accounting, that's fine. Because this is where they see that this is actually the payroll. So you can use the any of those two, but I will be putting more into our website and basically give you guys the roadmap. But just give us some time to get all that going. But I will have trainings maybe in about 2 weeks every Thursday to really help you guys navigate this whole thing. And maybe if you are a director, you graduate, I'm gonna give you some of my secret websites where you can pretty much get the CEO for majority of the companies in the United States. But we'll get there. We'll get there. Okay. All right. We are past 9 o'clock. So if I don't have any questions, I hope to see you guys next time. Usually Wednesday is Alan's day to do all of this. to do his training, but he's in Chicago. We actually have an office in Chicago, and we have a lot of business, coming up over there. Alan and I will be traveling to Texas, March 27th to the 30th. We're gonna go to Houston, and helping some teams over there. So both of us will be there for 3 days. So if any of you guys are in the surrounding areas that you want to come and learn some stuff or connect with us, it's very rare that you guys get both of us in the same place, because Alan is out there doing something else. I'm doing something else. I'm the compliant guys. I'm the compliance guy. I'm the guy behind the scene doing a lot of stuff. Alan's the one out there. But when it comes to training and taking care of the team and making sure we cross our T's and dots our I's, you can count on me. All right. So that's all I have for all of you today. I hope you were able to learn something from our training today. All right, Mr. Winchester, you're 2 hours from Chicago. Well, contact Alan. He's over there right now. He just landed today. Yes, it's in Chicago. So contact Alan. He'll let you know. All right. But if anybody doesn't have anything else, I
Real
guess
quick,
yes.
with the Thursday training, it'll be
Yeah.
6 to 7 again. I mean,
It'll be
8 to
8
9.
o'clock. 8
9.
o'clock. It'll be the same thing. 8 o'clock.
Got it. Okay. Thank you.
Okay. All right. So if there's nothing else, I say goodnight to everybody and thank you for putting your time out to come on today. And looking forward to seeing you guys next time. All right. Good night. Thank you, everybody.